That lived experience, patient partners can actually contribute in a meaningful fashion that can assist with shaping the future of our public healthcare service and be part of the decision-making process. You don't have to have a clinical background. You don't have to have a project management background. You can just be yourself, your lived experience. That's invaluable.
Welcome to the HSE Talking Health and Wellbeing podcast. I'm your host, Noreen Turley, and today we're delving into a vital conversation on patient partnership, exploring what it truly means to have a patient voice represented at the highest levels of the healthcare decision making. I'm joined by John Wall, a passionate healthcare campaigner from Lahinch. John lives in the Midwest, obviously.
The Midwest, I do,
but
yeah.
You work very closely on patient partnership in the new regional executive with Sandra Broderick. And you were recently appointed to the HSE Programme Improvement Board. Isn't that right, John?
That's right, yeah.
So do you want to just tell us a little bit about your role, John, and what's happening down in the Midwest?
Yeah, sure. Well, what's happening is change, involvement. What has happened over the last number of years is the HSE have recognised the value of inclusion, about utilising the lived experience of others, of service users. And when I say that word, service users, I mean everybody. It's not just the patient in the hospital. It's management, it's frontline staff, it's backroom staff, all age demographics, bar none. It's every single one of us. It's our shared lived experience that I guess is being utilised to a much greater extent than it has been in the past, because people like me were somewhat, I won't say feared, but people would engage cautiously because I'm not HSE. And I suppose in times past would have been fairly vocal on public health provision and what I thought of it. And that wasn't always negative. I guess the conversation was good, bad or indifferent type of thing. But I did get involved. I had a voice, and as Laura Brennan once said, I have a voice and I'll use it. And it was actually from her that I decided to use my voice, because Laura paved the way for many of us in that sphere, that patient experience, that patient advocate, healthcare campaigner. She used her voice. She was a friend, so I said, okay, why not utilise my own lived experience? At the time I was going through treatment in University Hospital Limerick. I felt that I had something to offer by sharing my lived experience, by engaging with the system. However, at that time, and that's only about 5 or 6 years ago, it was incredibly difficult to get the voice heard unless you took to social media. That was basically the only avenue at the time.
And is that why you're saying you were feared at that time?
I would have been feared. Well, feared is the wrong word, but I said people would engage cautiously. And for very good reason, because I had a very big mouth and I had to learn how to engage with the system. I mean, this isn't a process that has happened overnight for me. I had to build trust and respect. I wanted the system to, in order for me to engage with it, they have to see what I'm all about. And I said, that has taken several years, in my own case, to learn what is the behemoth of an organisation that is the HSE. But it's not just the HSE, it's the system, which includes the Department of Health, includes our government parties. It includes all our public representatives, all our service users, absolutely everybody. So whether it's within the HSE, within the Department of Health, there's a lot of complex relationships. There's no pathway for this. There's no map. It's like finding your way in the dark. But we learn from the experience of others. And I mentioned Laura's name. Another one is Vicky Phelan. Vicky and myself were good friends too. And we exchanged many views, had many of the conversation around advocacy and around what we could do or how we could engage at this level and how best to utilise our own lived experience. But again, I want to emphasise a point. It's not just our lived experience. We're just conduits through which other people can voice theirs, opinions, thoughts of view, ideas, solutions, problems. I guess that's where the conversation will go in a few moments as to what's happening in the Midwest at the moment and the opportunity that I and others are being given at the moment.
So when you think back to then and now, what has changed either in you or the system to give you a seat at the table now? What is it that's made the difference?
We've all changed.
Okay.
I have changed in that my modus operandi would be a lot more responsible. Over the course of time, you get to know the system, the people in it, how to effectively utilise the opportunities that you're given, which I have been given. And it's like a domino effect. It leads to other opportunities. It leads to other people seeing, maybe there's something to this. But I think the system has changed or is changing. It's an ongoing process, and I guess always will be, in that there's an element of trust and there's an insight as to and a belief that lived experience, patient partners can actually contribute in a meaningful fashion that can assist with shaping the future of our public healthcare service and be part of the decision-making process. You don't have to have a clinical background. You don't have to have a project management background. You can just be yourself. Your lived experience, that's invaluable. That's recognised. It's being recognised now. That has led to opportunities.
And how did that opportunity arise? Like, what happened? What changed? What shifted?
Yeah, it was a chain of events. I put out a tweet about cervical check. It was an issue that I feel very, very passionately about because of Vicky. And there was an issue that I just was unhappy with. So I put out a tweet and Bernard Gloucester responded directly. That led to a meeting between Bernard and myself, where we had a very honest and frank conversation. And stemming from that, he asked me would I address the senior leadership team from the HSE. And I got 1 hour unscripted with no agenda. Looking back on it now, that was really a leap of faith from Bernard.
And how did you prepare for something like that? Did you know? Did you plan what you were going to say? Were you angry? Were you annoyed? What were you thinking? Opportunity. Brilliant.
That lived experience is all upstairs in my head. For the most part, I ad lib. It's not just my thoughts and views. It's the conversations that I have with others. I bring all that and more to the table. That particular conversation I had with the leadership team, I look back on it and say, okay, that was the point at which things started to change for me and the opportunities that I started to get as a result of that, because others could see there's something in this. It's an opportunity for the system as well. I met several people as a result of that meeting. A year and 3/4 later, I find myself here talking to you.
Yeah, you're heavily involved really in the Midwest now. And I know that you're the forerunners with patient partnership and you're kind of leading the way.
We are, but I think that's down to our REO, Regional Executive Officer Sandra Broderick. She's the REO of HSE Midwest, and she has placed a lot of faith and her office in what I can contribute to the process in terms of the advice. At this point in time, there are two strands. One is the advice on establishing a fit-for-purpose structure for patient partnership in the Midwest. But yes, at this point, the Midwest, but also nationally. I feel that what we're doing at the moment needs to be fit for purpose, stand the test of time. It's like a foundation. What will be built on it over the years to come. Now is the time we need to get it right. It can be painfully slow at times, but there's a lot of moving parts to this. And the other part then is I view myself as a bit of a connector between the system and the people that use it. And the irony there is we all use the system.
Yeah.
I engage with community groups, with advocacy groups, campaign groups, individuals, all service users bar none, staff, HSE staff, senior management at our meetings, whether it be the Programme Improvement Board or any other meeting that I attend or any conversation I have. I'm able to sometimes have conversations that some of the senior management team might find perhaps difficult to have, because I'm not an employee. I suppose I don't have to look over my shoulder. The way I look at it is read the room, utilise the opportunity as it unfolds in front of me. And I mean this without in any disrespectful way to the opportunity that I've been given, but know my place. Just because I have a seat at the table doesn't mean that I have to interject at every juncture. That's not the point at all. It's when I deem necessary under AOB predominantly.
Yeah, it's amazing to be able to go in there and just be your authentic self, just be honest, open, and just say what you think or what you see without being a HSE employee and just wanting better for the service and wanting the services to be better and to have people to listen to what you say. And that's great, but you're one person and you can't carry the words of every patient. And I know I've spoken to Anne Lawler and there's so many people in the Patients Forum, there's not a huge number either just yet, and I know we're going to be developing that. But you are only one person. That's a lot of responsibility.
It is. And that's something that I discuss at every available opportunity. I am but one person, and it's not about me. Absolutely not. It's about all of us. And that's why the structure that is evolving at the moment is so important. As part of the Programme Improvement Board, there are 5 subcommittees. I want a patient partner on each one of those 5 subcommittees.
So this is just for the Midwest, there's 5 subcommittees?
Yes.
Okay. So at the moment you're on all 5?
No, I'm that's exactly the problem.
Yeah,
but
I
suppose it's a bit like you have to speculate to accumulate type of thing. In that, in my first couple of meetings at the board meeting, I thought, okay, there's a lot happening here. I'm not a HSE employee. There's a lot of acronyms being used, a lot of detail. that I had no understanding of. There was a lot of information to be processed, and I quickly realised this is far beyond the scope of one person at the Programme Improvement Board. So I've been talking with the Sandra at her office and some of the other management team about utilising the subcommittee structure to appoint patient partners in some way, shape or form on those committees. They would also act as a filter. They'd collate, I suppose, the necessary information, ensure that it's on the appropriate agenda, which would then feed up to the Programme Improvement Board. And I would raise whatever issues are necessary arising from those subcommittees at board level. That is happening. We need to be very careful that people also know what they're letting themselves in for, because it can be a very challenging place to be at times.
So explain to the listener then, what does it look like on a day-to-day basis? I mean, you have a full-time job.
I do, yes, yeah.
You also have to look after your health.
Yeah.
You've had health issues, or you have health issues. I'm not sure if you want to discuss that or not.
Sure.
But how do you get the balance with all of that?
Right. Well, I suppose you asked about the health issues. I'll use the opportunity as well to get the message out there about looking after yourself, and men in particular, look after your bodies. Don't take your good health for granted. In 2017, I was diagnosed with stage 4 prostate cancer and went through a barrage of treatment at home and abroad. And it wasn't looking good, not looking good at all. But fortunately, somebody got it wrong somewhere along the line, because I'm still very much still here and doing extraordinarily well. I'm not on any treatment. And
no treatment at all?
No treatment at all. Doing extraordinarily well. I now look forward in life, don't have to look over my shoulder anymore. But the main point of that is simply not to take your good health for granted. I equate it to car servicing, especially for guys. We look at, if our car tells us it needs a service, regardless if it needs a service or not. If the car says so, absolutely. Book it into the garage, get the car serviced. But our bodies, we wait for something to go wrong before we ever attempt to make an appointment with a GP or any other healthcare professional for that matter, where I would encourage, regardless of how you're feeling, once a year, make that appointment with a GP or a nurse practitioner and just give yourself a once over, just to make sure, body and bloods, that everything is as it should be. If I had done that many years ago myself, I wouldn't have ended up in the mess that I ended up with. But I look back on all of that as, again, an opportunity, because if it didn't happen, none of this would have happened either.
Have you always been an optimist? You seem like a very optimistic person.
No.
You're very, everything is an opportunity. Everything, you've mentioned opportunity quite a few times.
Well, I suppose life is an opportunity.
Yeah.
I didn't realise that until I was told to get my affairs in order.
Yeah.
And then all of a sudden, my outlook changed. I thought, geez, where's this going?
Yeah.
You look at life through a different lens. And I live now by the mantra of carpe diem. And I literally seize the day. Some of them aren't great, but you still make the most of them.
Yeah.
And I've been given a second chance, so I have no intention of wasting it.
It's an amazing outlook as well, and I can understand how you have that outlook now. How do you then balance all of the work you're doing with patient partnership and your job and your health? So you have all of that work, meeting all those groups in patient partnership and trying to bring all those voices forward. Can you go into the shop down in the Midwest at all? Or are there people coming up to you in the local shop saying, John, did you hear about this? I mean, next thing we'll hear you're running for election or something, John.
Absolutely not. That's what it won't morph into, although it can, unless we let people know that it's not a complaints hotline. It's not an opportunity to raise every single issue, because there are tens of thousands of them.
How do you stop it? How do you stop that happening?
Say no. But we have been doing interviews locally, Sandra and myself, with local radio stations, and we're letting people know what it is, and like that, importantly, what it is not. There's a process through which anyone that has an issue with the HSE, a process through which they can submit their grievances and air their differences, or indeed if you have something good to say, there's an opportunity to do that as well. But what I'm getting involved with is not that. That's not to say that if there's an issue out there that needs to be raised, that I won't ensure, or my partnership colleagues won't ensure, that we'll bring it to the relevant table. We absolutely will. And that goes back to that filter that I was talking about earlier on. Again, it's going to take time. Yes, there are going to be people that will say to you, listen, this issue and that issue and all the rest of it. I'll have those conversations with people, but I'll also be telling them that I'm not that person that's going to bring every single gripe to the relevant people. And going back to your question about time and how I manage to do it, I have a very understanding employer. I get my job done. I like to think that I do it okay. And this is my hobby. This is my spare time.
I think it's very generous of you to say that.
But I enjoy it. It's therapeutic for me. It's all this has happened. My health, everything that happened in respect to that, I must think it happened for a reason. And I look back now and say, okay, again, it's an opportunity. It's also therapeutic that I can use not just the lived experience in terms of my own health, but in terms of my own interactions with the system over the last several years. I can utilize that. I get great resolve out of that, knowing, the diagnosis meant something.
Yeah.
And something can be achieved as a result. And that's how I see all this.
Yeah. When you originally started to have a seat at the table, how did you gain the trust of the people within the room? It can be a difficult...
It can. You have to have confidence, and it's not tokenism. Eye contact is something for me that's important, as I'm doing now.
Yeah.
In that you're not afraid to look somebody in the eye, and you're not there just to listen. You're there to interact. You're there to make a difference. You're there to contribute. And very important as part of any meeting that I'm at is the sidebars, is engaging with people, not just in terms of work, as it were, from an advocacy perspective, but just casual conversations with people. Because everybody is a person. Senior management, they're all people. And in times gone by, there was a them and us scenario that unfolded. And it was a culture that was there for years and years and years.
Is it a culture of fear, though? Is it a culture of fear of doing something wrong, of getting caught out? Is it that?
Yeah, and perhaps understandably so.
Yeah.
But that is evolving now to where we are. I was in a room on last Tuesday with the senior leadership team from the HSE and the management team from HSE Midwest. So all the Bernard Gloucester, as CEO, and the 6 REOs were in the room. We had various different conversations about all things non-HSE before we started and after we finished. And that's part of the process as well. Let people see the real you, but also you want to see the real them. You establish a rapport and a working relationship built predominantly around trust, because you'll be privy to conversations and a lot of very sensitive information that in order for you to make a difference, you have to be in receipt of all the facts as they are. And some of that is hard hearing. And I suppose part of it as well is you won't always get what you want. There are issues that are raised that'll take not just years, but generations to resolve. So, as the old adage goes, Rome wasn't built in a day, and our healthcare system is not going to be everything that we want it to be in one foul swoop. It will take, will it ever be? No, it won't. But will it be better? Yes, it will. Will it be more efficient? Yes, it will. Will we look at it in years to come and say, you know what? People made a difference. We'll do that too.
Absolutely. And I suppose I did want to ask you about some of the challenges of the position that you've kind of taken up, and being that patient representative or being that patient partner, and the difficulties or the challenges that you see within that.
Challenges. There's a lot of responsibility there at the moment to try and get this right. And one thing that I'm very anxious of all the time is that what we're doing in the Midwest is not necessarily correct. It's not necessarily right. And that's why I'm so keen to get all the other regions involved at this point. And these are foundations that partnership for the future will be built on. So there's a lot of weight on our shoulders now in terms of the difficulties. I don't see it as a potentially difficult what I'm doing, because I enjoy doing it. And as I said, I find it very therapeutic. What I do find difficult at times is saying no to getting involved in other projects. And but I have done recently, and for good reason, because I've gotten to a point where I'm happy to proceed as is. But if I got involved in much more, I would only dilute the effectiveness of what I'm actually doing. So,
can you just give us an overview of what is happening around the country? I know that there's new patient leads in the system. Is that right?
They're not in the system yet, but recently the posts were advertised. There were 6 posts advertised for the 6 regions, and that patient lead would work within the REO offices of the 6 regions. And I won't say replicate, but akin to something that is happening with HSE Midwest at the moment, and where a lot of what I'm doing at the moment will become part of whoever is appointed in due course as patient lead would assume a lot of the responsibilities of what I'm doing at the moment. And I would focus more, I guess, on the Programme Improvement Board. But I would also feed into the process, and that patient partner, I would engage with that person. It's about membership of the Programme Improvement Board. You have the patient lead. You'll have 7 people involved at subcommittee level. So then that group of patient partners would have a significant contribution to all things HSE Midwest.
So is it like having the patient forum that's currently at national level? There'd be a patient forum in each of the regions?
More than a forum. I think
Okay.
a forum is where we talk. I'm a member of that National Patient and Service User Forum. We talk, but I think it's more regionalised in terms of the patient partnership approach locally, where you have your patient lead. Bear in mind that the HSE Midwest are the only ones with an improvement board at the moment. That's not necessarily something that will be replicated elsewhere, although I would like to see it established in some way, shape or form. But there's a lot attached to that. It's not just a board. There's a lot involved in establishing its structure. And again, this has taken a couple of years in the Midwest, so the timeframes here are extensive, but we have to start somewhere. In terms of it being a forum, I see it being more of an interactive opportunity for patient partners, and whatever, depending on the personality and the people involved, I'm sure they'll contribute just as much. And then between the lot of us, we'll make a difference.
Yeah.
The conversations that I have, I would say several times a week, there's nothing off limits, and I mean nothing. The system really has embraced the partnership approach in the Midwest. And to be fair to Sandra Broderick and her team, I have been privy to everything that's going on. And some of it is, difficult hearing. But in order to make a difference, you have to be fully informed. And that involves a lot of trust. Yeah. Which thankfully we have. But for others to recognise as well, it does not happen overnight.
Yeah, it's going to take time.
It
really is going to take time. So this year, the Patient Partnership had their second conference. And out of that conference, was there any nuggets of information that you really thought, if they carry this forward, this would be great? Or is there any progress from that?
Yeah, I would go more so, it's not just nuggets of information, it's every single nugget of information. When you have a room full, as the Service User and Patient Partnership Conference, when you saw the amount of people in the room and the contribution that everyone made, whether that be during the official conference itself or in sidebars the night before.
Can I just clarify as well for people? So the patient conference, I should have explained at the beginning, was for people, anybody who had an interest, or any service user, or anybody who has an interest in service improvement, really, around the country.
Yeah, and it's a fabulous opportunity for everybody to get involved. To be able to liaise with senior management teams, to be able to engage directly with people that a lot of, it would be difficult to get access to at times, simply because their diaries are full, not because of any unwillingness to get involved. I'd love to see in due course that conference, we'll say a mini version of it elsewhere, to allow others from other parts of the country participate. An incredible opportunity. The conversations that we had that day, and indeed the night before, were absolutely crucial from my perspective. Crucial in meeting people at that conference that I wouldn't have met. And from the forum itself, that one actually I'm meeting next week. It's through opportunities like that we get to meet each other, because online is great and fantastic and it's brilliant and it's efficient and it's cheap. But there are times that the in-person experience is an absolute necessity. And when you have an opportunity once a year, as we do at the conference, it's a very interactive approach to partnership, in that you have the opportunity, I've said the word a million times, to chat with others and then with you, and to harmonise our approach, to plan for the future and to learn from each other.
And if you were to plan for the future of patient partnership, what would it look like to you? That's a big question.
It is.
Or even just think about the Midwest for now, say even the next 2 years, I suppose, or 3 years.
Okay, the next 2 or 3 years, I would like to see the structure as it's evolving at the moment established. Again, the Programme Improvement Board, you have the involvement there, you have the subcommittees, and also a more structured approach across the Midwest in terms of people that you liaise with in the community. The service users, and I'll go back to the word service users again, because I'm very, very keen to include absolutely everybody, but I guess what I'm saying is the network that's there, I want to see the dots joined, because it's only by doing so we can ever hope that the service we want provided will be provided, and learn from absolutely everybody from West Clare to North Clare to North Tipperary into Limerick, and to have a network there where we in some way, shape or form can contribute and continue to contribute to shaping the service ultimately that's provided. And nationally, I'd like to see that replicated in an appropriate manner around the regions, and a process where that can be fed through to national. We're feeding into a system, we're learning from it. That lived experience of each and every one of us helps shape our national health service. It's something that I think we'll see in a similar guise. We'll see it operating forever, I hope.
Yeah, I mean, it's great to hear the way that you talk about it, that it is evolving. There are inroads. we are making progress and there are future plans for it, and hopefully it will be ingrained in all of the health services really going forward. One of the things, as you were talking there, I was thinking, when you look at the current patient forum, everybody that's there is there for a reason, and they've got their own reason that they're there, whether it's because of an experience or because they belong to an organisation or whatever. And I think we probably touched on this earlier on again, but how do you stop this individual agenda, if you know what I mean, to stop the individual agenda taking over the bigger picture?
By listening. Just because you may not bring that agenda to the table doesn't mean that it can't be listened to. And you can't think we all need to understand what that person or group, what is their message? What do they want to get across? I don't necessarily personally agree, for example, with the opinions of everybody out there in terms of what we need, what kind of service is needed. There's a lot of talk at the moment. Do we need a Model 4 or a Model 3 in the Midwest, extra emergency departments? And I've refrained from much public, or for any kind of public commentary on that, because I don't understand the nuances and the complexities. And there's going to be enhanced service provision over the years ahead. There are going to be decisions taken over the coming months and perhaps into the first half of next year, long-term developmental commitments for HSE Midwest. But I'm not a medical professional. I wouldn't say A needs to be done or B needs to be done or C needs to be done. I leave that to the professionals. I know something needs to be done. When others make that decision, I'll take a look at it in conjunction. Well, we all will. All of us involved in the process have a vested interest in this and progress that agenda. But I think everyone else's voice is crucial. And they all need to be listened to and fed into the process. And what comes out the other end is something, again, that, like this whole process, will stand the test of time. So anything that does happen in the Midwest, it can't be reactionary. I think too many decisions taken in times past have been reactionary.
Yeah, I think that's a really important point, actually.
Yeah, and we've lived to regret them.
Yeah.
People made them for the right reasons at the time, but very reactionary. Moving forward, we need to get it right. We need to listen to people, and that's why everybody's opinion counts. You collate everything, and then you, I suppose at the appropriate forum, try and come to a consensus that leads to change for everybody. Not everyone will be happy, and that will always be the case. All you can do is try and do your best.
Yeah. And if you wanted to give advice to somebody who's listening, maybe who would like to get involved in patient partnership, would there be advice that you would give them? If there's somebody new who wants to get involved in it, what would your advice be to them?
Do it.
Do it.
Oh, yeah.
Yeah.
I think there's no hard and fast rule as to, how much time you want to dedicate or what you do. It's in any way, shape or form. If you have something to share based on your lived experience or indeed that of others, family members, if you want to get involved, don't be shy about it. Yeah. It's a public health service. It's your health service. And we all own it.
Yeah.
We all can contribute to it. And in some way, shape or form, we all use it.
Yeah. It's like when Anne Lawler came on the podcast with me, she said, our HSE, it's our HSE, Noreen. It's not mine or yours. It's ours. It's all of ours. And I just thought, God, it would be so great if everybody did speak about the HSE like that. And the people working within the HSE. That was the other thing I wanted to ask you about, John, because I know you do think about staff and you have been talking to staff as well as part of all this work that you're doing. And what has kind of that taught you, or what benefit is it to speak to the staff in the areas? Plain
English, because a lot of what I hear at a particular level is sometimes can be really difficult to understand, to comprehend what actually is being discussed, because there's a handbook for medical professionals or those that work within the confines of the health service that simply are just beyond my comprehension.
Yeah.
But when you talk to staff, you get plain English, you'll get an undiluted version of what you need to hear. And that's not necessarily all the negatives. There's as many positives thrown in there as well, but you'll get, again, their lived experience, their daily experience of working within the HSE, and their contribution is absolutely invaluable. And again, I'd like more of it to happen, but I know that our own REO has been engaging with frontline staff and others, seeking their opinions about what's gone wrong, what is going wrong, what's going well, what are we doing right down there. And that's really important, that those conversations in times past, the message would have been diluted by the time it got to a particular level of management. And to have the conversations directly, that's nothing against middle management. Absolutely not. But it's very, very important that undiluted conversations are had. Respectful engagement is a huge part of this from all of us, in that you can understand there's a lot of anger out there. There's a lot of anger. There's a lot of staffing issues. There's an acknowledgement out there. There's a lot of our health services perhaps understaffed at the moment, but that is in the process of, I won't say being rectified, but certainly the staffing that is required is slowly coming on stream. So you can understand the frustration. I said anger, maybe not anger, but frustration, perhaps sometimes anger of staff. You can understand that, but that needs to be conveyed, undiluted, to the appropriate senior managers as well. And that's happening. There's respectful conversations being had. And it's only by having them that any of us can hope to understand what actually is happening on the ground. Yeah. Because you can make all the decisions you want at a particular level, but there's a layer of people below that implement those particular decisions. But everyone needs to know the ramifications of the decisions you're taking and how they're perceived on the ground. The opinion of staff is an absolutely vital part of this partnership process.
Yeah, and I think you spoke about listening, and for staff to feel that they are being listened to is so important, and being listened to by the most appropriate people, like you say, closer to the people that are working on the front line. As you said there, it's so important to feel that they're valued. And I mean, everybody gets up and goes to work every day, I believe, with the right intentions and wanted to do a good job, and particularly in healthcare, so.
Completely.
Yeah.
The responsibility that employees of the HSE have is absolutely phenomenal. There are literally lives at stake. And apart from that, then you have the ongoing infrastructural development of the HSE. I don't know how they deal with the pressures of working within at times. It is staggering, the deadlines that need to be met. And I suppose we need to be aware too of the relationships and the complexities of the system as it is between the Department of Health and the HSE, in that a lot of ire is directed towards the HSE. But I think people need to know as well that the Department of Health, in terms of the political arm of the decisions taken and subsequent implementing of those decisions from government, etc., there's a very complex relationship between the department and the HSE, and for very good reason, in that it's a public service, and public services cost a lot of money to efficiently implement. And there's not, regardless of how well our country is doing, there's not an unlimited amount of funding for every request. So difficult decisions have to be taken. But from what I have seen over the last number of years, there's no one in the HSE that doesn't try their absolute to get what they need for their department. Some are successful, some are not. I think that's why it's so important that people understand that it's not just the HSE. We have a department in our governmental structure called the Department of Health, and they are the ones in a lot of cases that make a lot of the decisions that have massive repercussions for public service health users.
And John, we're coming close to the end now, so I just wanted to ask you, if you had one thing for the listeners to take away from our conversation today, what would that one thing be?
Hope that change is happening. And in my own experience, it was talk, it was box ticking, it was chatter, it was electioneering, it was all of the above and much more besides. But I genuinely believe there's hope for the future, and that hope will lead to change. It will lead to a system that I won't say that we can be proud of in its entirety, but we can certainly be prouder, and a lot prouder of it than perhaps we have been in times past. I wouldn't say it if I didn't mean it.
Yeah.
Because
I don't think you say anything that you don't mean, John.
No. I suppose what I mean by that is, in years gone by, not just years gone by, when I need to be, I can be just as vocal about things that don't work, or issues that I have, or whatever the case may be. But I genuinely believe there's hope for the future. And indeed the present. I can see that the changes that are happening at the moment, it's slow, and it will be slow for the time being. There's a lot to change, but there's a lot to be hopeful for as well.
No, and I think that's a really good note to end the conversation on. And for anybody who's listening, the forum welcomes new members all the time. And as John said, there's going to be a call out for more and more people as time goes on to be representatives around the country. And you can get in touch with the HSE Patient and Service User Engagement Office at patient.partnership@hse.ie. So that brings us to the end of this HSE Talking Health and Wellbeing podcast. A huge thank you to John Wall for sharing his journey and shedding light on the meaningful, sometimes challenging work of patient partnership. John, your dedication, your absolute commitment to patient partnership is unbelievable, really. And your engagement with it and the way that you've embraced it and the way that you can see hope in the future for it is really, really encouraging. I think for our listeners, I hope this conversation has shown you how crucial and important that patient perspectives in decision making across the HSE is so important across our health services. I think that each of us can have or has a role in shaping a better healthcare system. And I just thank you, John, so much for everything that you're doing and everything that you will be doing in the future, because you have a lot of work that you're taking on. And so I'd like to thank our listeners for tuning in again to another episode of HSE Talking Health and Wellbeing.